I now want to turn the mic back over to Kara Ayers, who's going to bring Courtney back on. Kara, do we have you?
On here? Yes,
yeah.
I believe I am back on. And Dr. Tosi, was Courtney previously introduced? I wasn't sure because I wasn't on at that time.
Yes, she was.
Yes.
Okay. So I'll make it very quick, and that I'm honored to introduce Courtney. As I stated before, I've really appreciated my involvement with PCORI. Courtney, just to remind you, is a Senior Program Officer for the Eugene Washington PCORI Engagement Award. So, Courtney, I'll leave it to you. Thanks.
Thank you so much, Kara.
Actually, would you just make a quick statement about your activity with PCORI?
Yes. So I joined the PCORI board in a little over a year. So it was a year ago in October, and I'm the patient representative. At this time, I'm the only patient representative. I think we may have some changes in board makeup coming up, but we won't know that for a few months. But I've learned a great deal about healthcare systems from a large scale all the way down to how to really make these patient groups work. And I think I really appreciate it as well as a researcher in terms of continuing to wrestle with that question of how do we really facilitate authentic engagement. So it's more than just kind of letting patients have a rubber stamp and saying it's okay. It's how do we really facilitate that process from start to completion. So I've really enjoyed my work with PCORI, and I'm happy to have Courtney with us too.
Thanks so much.
Mm-hmm.
Thank you, Dr. Tosi, and thank you, Kara, for sharing a bit about your experience at PCORI, and PCORI is very happy to have you as well. I'll be sharing this afternoon with you about opportunities for folks to engage with PCORI. I'm just pulling up my slides right now. As we've seen, it takes a little bit of time. There's a little bit of a delay. And again, I will move to turn my camera off to ensure that there's much less of a lag in the video. So maybe I should have done that first. There we go. All right, so here we go. All right, so hello again. As I said, I'll be sharing a bit more about PCORI's portfolio and including information related to some rare disease projects that PCORI is funded and under the Engagement Awards as well as under the Research Awards. And at the end of my presentation, I'll also provide you with some links that you can use to stay informed and connect with PCORI. So one of the main things that we're working on right now is the fact that our advisory panels they have openings. And just to give you a bit of background about them, the advisory panel usually includes representatives from across the healthcare community who help to advance our scientific and engagement work. Applications for that are due on April 10th, and they can be found on the PCORI website. I have a link for that a little later in my slides. Also, there are opportunities for you to engage with PCORI as a merit reviewer or a peer reviewer. And again, there are links for that a little later. So this slide here just shows you the amount of funded awards that we have. We have more than 1,400. We have funded more than $2.6 billion across the nation, including DC and Puerto Rico. You can see that we still are lagging with funding any projects out of North Dakota. It is our hope that that will soon be changed. We have a few open funding announcements right now, both under the Engagement Award program as well as in our research portfolio. So PCORI's research really is focused on high priority conditions, conditions that affect a large number of people, those that place a heavy burden on individuals and society. And also we have focused high priority on rare diseases, which may in some cases be difficult to study, particularly when you're considering CER or PCOR, because many diseases have not previously been studied, and therefore there are fewer comparators or interventions that have already been proven effective to study them under PCOR. Recognizing that, PCORI has funded, let's see, well, you can see, I guess, this slide for yourself, but we funded, so much. And our primary areas of focus for research funding have been under mental and behavioral health and cancer. Populations most studied include those who are racial and ethnic minorities, as well as those who have low socioeconomic status. This slide here gives you an idea or a spotlight on the funding that we provided for rare diseases. We have funded 31 research projects on rare diseases, totaling up to about $93 million. And those rare disease projects that have been studied include Kawasaki disease, sickle cell disease, and cerebral palsy. And I'll talk to you a bit more about the Eugene Washington PCORI Engagement Awards, as well as the Pipeline to Proposal Awards. And both of those are not funding for research awards. They are funding for research support. And they have both provided funding for building research partnerships, for the development of governance and research infrastructure, and increasing PCOR capacity. So under the Pipeline of Proposal program, 353 awards were made, amounting to about $4 million before the program ended. And with the Eugene Washington PCORI Engagement Awards, we funded 478 projects, totaling $96 million as of April 1st. This slide here just provides two examples of research projects that are focused on rare disease. The first one, which is focused on Kawasaki disease, is still recruiting, even though it was awarded in 2016. And then the one on the bottom is focused on Duarte galactosemia. And that one has been completed, and research findings can be found on the PCORI website. And I decided to take a few of the projects that PCORI has funded that are encompassing rare diseases, and they can be found on this slide. Let's see, I guess the first one is actually this project. And the project lead is Tracy. We also have funded projects for organizations that have since gone on to receive funding from the Chan Zuckerberg Initiative for Rare is One project. That provides funding for patient-led 501c3 organizations that are focused on rare diseases. And it allows them to launch collaborative research networks in partnership with clinicians and researchers. And let's see, we have, I think, about 4 or 5 of our Engagement Award alums who were able to go on and receive that funding. And in many cases, they started with us for convening funding. So they received conference support from us, from the Engagement Award program, which allowed them to bring together their constituents and allowed them to identify a path forward and to also build that research infrastructure that has allowed them to go on and now receive even more funding from Chan Zuckerberg. And I wanted to highlight the IBEMC stakeholder network that is inborn medical errors. They have in the past, they had an engagement award, and out of that engagement award came a training on PCOR and CER, as well as additional information related to how to build a rare disease network. So I thought that might be interesting to this community, and their training and other resources that they've created can be found on our website in our engagement resources repository, and I provided a link for that also at the end of my slides. So next I want to give you a sense of ways that you can engage with PCORI. And this slide here identifies 3 new funding opportunities that we have available under the Engagement Award program. The due date for the LOIs is May 1st. Initially it was April 1st, but given the nature of the pandemic that we're in, we recognized that we needed to push that back to allow teams to be able to pull together their project ideas, especially since a lot of our awardees are based on university campuses. We recognize that several of them are not able to get to the university at this point in time, and so we wanted to allow for additional time. So the funding is available for capacity building towards PCOR. It's available for active dissemination under our dissemination initiatives. And the active dissemination really is the dissemination of research findings, dissemination of PCORI, I should say, PCORI funded research findings. And then we provide convening support, and that's in the amount of up to $100,000 for a year period. And under the convening support, you can bring together stakeholders to explore critical issues related to CER and or communicate PCORI funded research findings to targeted end users. This next slide here just gives you a little bit more about our PCORI Ambassadors Program. And the PCORI Ambassadors Program is a volunteer network of individuals who are dedicated to changing the culture of healthcare research. So we consider our ambassadors to be the boots on the ground and really kind of like a supplement to our organizational efforts. Let me just state that PCORI ambassadors are volunteers and not representatives of PCORI, but as some people refer to those who are really trying to engage in PCOR, these are folks who have, in a sense, drunk the Kool-Aid, and so they're really standing behind PCOR, and they see that the change that it can make in the research enterprise. And to become an ambassador, you can fill out an interest form on our website, and also complete a short online training. This slide here gives you an idea about the key goals of our merit review program. We do have merit review panels that include scientists, patients, and stakeholders. We have that lineup to make sure that we bring diverse perspectives to the review process. And each research application is assigned to three scientists, one patient, and then one stakeholder. And there's an external scientist who serves as the chair of the panel to help facilitate panel discussions. So requirements for scientists include an advanced degree in health or research-related field, relevant peer-reviewed publications, and an active research program in a relevant field of study. Stakeholders and patients should have some lived experience as well as contribute a unique healthcare system perspective. And more information about that can also be found on our website. And we just actually held a merit review panel just the other day, and it was held virtually, given that we are in a period of social distancing. And my understanding is that that worked really well. Coming up later this year, we're hopeful that we will be able to hold our annual meeting, which is scheduled currently for September 16th and 17th at the Crystal Gateway Marriott in Arlington, Virginia. You can find out more about that on our website. The meeting is free and open to the public, and there are patient scholarships that may be available, but please be sure to check our website. We have many sessions that are engagement focused as well as research focused, and this is a great opportunity for, in a sense, PCORI kind of to show off and show what we've been doing within this last year, and share some of the findings that have come from projects that we've funded, and especially when there are learnings that can be shared with the public. So this slide here has several words. I know, Dr. Tosi, I'm supposed to keep it under 23. I think I've expanded beyond that. But these are links that I thought were pertinent to this group, where I provided a link to the PCORI advisory panel openings, and there's a link that can take you to find out more information. And then also there's a form that can be completed. These 5 panels are seeking new panelists. So it's in our health disparities and delivery research, the patient engagement panel, the clinical trials panel, and the rare disease panel, as well as the clinical effectiveness and decision science panel. Here's a link related to our peer review process. And then here's also a link on PCORI engagement tools and resources repository. And so this, I mentioned a little bit earlier that we have resources and tools that have come from both funded research projects as well as funded engagement projects, where project deliverables or resources and tools that were used during those projects were deemed along the best practices of. So best practices for engagement, whether or not it be for developing governance structures or for training about specific health issues or specific areas on PCOR or CER. And we started compiling these and then recognized that we should make these also available to the public, especially considering that PCORI funds are public funds. And so the public should have the opportunity to find out what is being funded and what is coming out of funded research projects.
Just said I'm in
projects. And then finally, there's a link to subscribe to PCORI's newsletter. This allows you to stay informed about any research findings that are being made available. It informs you also about activities within the organization and other opportunities for research and or engagement funding. And so that's all I've got to share for the moment. So thank you for your time today. And then my contact information, I guess I can share that too, is here on this slide. So if there are any questions or concerns that you have following this this presentation, feel free to reach out, and I'll be as best I can.
You're absolutely perfect. You finished exactly on time. And I'll turn this back over to Michael. What I would like to do is, if people have questions specifically for Courtney, I would ask you to go with those first. And then if there are other questions for myself, for Tracy, for Bryce, Amy, going forward, we'll have an open mic for as long as you want to participate as we look at going forward. Once again, I hope everyone has signed into the chat line with their name and email address, and please look for our survey coming your way quickly. But who has questions for Courtney? Michael, take the lead, please.
Yeah. So while you are typing in your questions into the chat, we actually have one for you now. How were national research priority areas identified?
Sorry, I didn't start the video, nor did I unmute myself because I muted.
It happens.
So generally, the national research priorities have been identified through congressional legislation, through which PCORI was initially founded, and then when PCORI was reauthorized, we received new guidance for our national priorities.
Excellent, thank you. One question, I believe you addressed this early in your first talk today, but could you just briefly explain again, how is PCORI funded?
Sure. So basically, PCORI is funded from a trust fund. So we're a trust fund baby, right? But we get funded from a trust fund, and the funds for that trust fund have come from, I don't know if you all ever look at your explanation of benefits forms that you receive related to like health insurance. On there may be something that states PCOR fee. And so that PCOR fee, patient-centered outcomes research fee, to every health insurance company is expected to pay $2 per capita for everyone who is covered under their insurance program. So refer to payers, the payers that we refer to are those insurance companies who have great interest because they're paying money into our trust fund. So they have great interest in what it is that we are funding and the direction in which we're going.
Great, thank you so much. I appreciate that.
Sure. Oh, and then I guess also we have also received, or at least our initial funding came, I think, in the amount of about $100 million from Congress.
Great, thank you. Do we have any other questions from the group? So I see a question here. I'm going to read it out loud. Could you speak more on how patients can become more involved in PCORI?
Sure. So among the ways that patients can become more involved with PCORI are the ambassador program, and then also involvement in our advisory panels, and also through merit review. We try to ensure that the patient voice is weaved throughout every aspect of PCORI. We do also have a place on our website where folks can identify topics or research questions of interest to them, and those get kind of funneled through, and then our various work teams read through them, and it helps us to identify, you know, some of what our priorities or any targeted funding could be for the year. Those are then, you know, brought to our various oversight committees, and then which our oversight committees are made up of our Board of Governors members, and then they help to determine what our next steps will be, particularly when it comes to targeted funding initiatives. So yeah, so I guess to sum it all up, really, I would say maybe get started looking at our website and seeing if there are any particular areas in which you may be interested in engaging, whether it be as an advisory panelist or serving on a merit review panel as a patient, and then also serving as an ambassador if PCORI is something that you're interested in not necessarily representing, but participating in. A good place really to get started, of course, is at our annual meeting, which right now is scheduled for mid-September. And so, you know, hopefully whoever that is might be interested would be able to look on our website, and if a patient scholarship is something that they may need, they could then apply for that patient scholarship, and PCORI would cover the cost of their participation, which basically would include accommodations and transportation, as well as, I believe, a little bit of a stipend for food.
Great. Okay, thank you so much. Do we have any other questions from the audience? Speak now or forever hold your peace.
Yeah, so it looks like somebody did mention that PCORI is a part of the original Obamacare. So yes, we were initially founded out of the Affordable Care Act. And so we recently have been reauthorized. So we are sticking around beyond what our initial authorization was for.
Great. So it seems like that might be it for the questions for now. Thank you so much.
Courtney, I cannot thank you enough. That was so clear and so helpful. And I think we have a number of people on the call who are going to look forward to working with you. That's just great. Okay, so what a team. So many people are still on this call, despite the fact that I strongly suspect there's an advanced case of fanny fatigue going through this audience. But thank you for participating. And as I said earlier, if people have specific questions about what the OI Foundation is going to do, etc., we will keep an open mic going for as long as there are questions. And once again, if you haven't put your name in the chat box with your email, please step up and get it done. We want to know who you are. And I'm hoping you want to get our additional emails with some of the articles that were discussed today. So with that, huge thanks to Tracy, Cameron, our speakers, Michael for keeping us organized, but thank you for being with us today. And please feel free now to